This is an intumescent cataract, intumescent mature cataract, and I have started my incisions. I go ahead and then stain the capsule with trypan blue, after which I expel the trypan blue with 2% HPMC. I then take my bent 26 gauge needle, which I use as a cystotome, and perform a rhexis. Now, this being an intumescent cataract, I am forced not to venture into the zonular area. I decided to go ahead and do, if it was going to give me trouble, I would have done a double rhexis, but looking at the way things are going, looks like I'll be able to finish the rhexis one shot. So I have to do this very tentatively, as any misadventure on my part, and I will be looking at the flag, the Argentinian flag, raising its head. So that's a fairly okay rhexis, probably a 4.5. I then just wash off the superficial cortex, at the same time wash off some of the peripheral cortex as well. Make sure that the nucleus is mobile. That's it. Pressurize the chamber with some BSS. Put in some HPMC. This is a slightly harder cataract, so I go with a very sharp chopper. It's a 1.5 mm chopper, very sharp. Raise my Phaco power a bit, because this is not that soft a cataract, and I'm going to do the direct check. Now you have to understand, in this case, I cannot pull out the pieces through this rhexis. This rhexis is on the smaller side. So any false moves like this, if I try to just pull it out of this bag, I will definitely cause zonular dialysis. So I have to break all the segments within the bag, and then when they are small enough, only then can I handle it. The other way would be is to extend your rhexis, and then you can do the normal way of doing Phaco, whatever that is. So I'm just trying to make as many pieces as possible, making sure, trying my best to see that the central spine is broken, and that's very important. I cannot have it hanging around there. At least now I know part of it is broken. I have a few segments. Once I have that, it's very easy. At least I'm a little more at ease. The other important point in this case is, remember that your rhexis is small. Don't by mistake use your sharp chopper to chop the rhexis. So see where you're going in with the chopper. Looks like I have enough segments. Trying to eat them up now. Yes, they are coming out. So probably a better idea to substitute that sharp chopper with a blunt Sinsky hook, but as usual I keep forgetting or whatever. Anyway, I'm using the same sharp chopper, but I would advise it would be a better idea to use a blunt instrument in the left hand at this point in time. However, all seems to be going well. That piece seems to be attached, but it's okay. Yes, it's got dislodged, and that's it. Managed to get out all the pieces. There's a bit near the paracenthesis. I get that out as well. And now it's time to remove the cortex. And since the rhexis is on the smaller side, it is better to use a bimanual method of aspiration. You have to be very careful that this is an extremely advanced case. So don't forcibly pull the cortex from the phonesis. Sometimes you'll be surprised, the whole bag will present itself to you. So just engage, bring it out, see what it is, and only then aspirate. If it is attached too firmly to the fornix, I would advise just leave it alone. So once all that is done, I hydroimplant this IOL. Yeah, this is a single piece. This is a hydrophilic lens. Single piece hydrophilic lens. I inject it directly into the bag and conclude surgery. Thank you so much for watching.